Good morning everyone. I am presenting a clinical case of posterior polar cataract. It is an elevated plaque-like onion ring shaped or bullseye appearance opacity which is present on the posterior pole of the lens and densely adherent to the posterior capsule. It is hypothesized that PPC results from hyaloid artery persistence and it is an uncommon form of congenital cataract with an incidence of 3 to 5 in 1000. A 40-year-old female presented to our OPD with the chief complaints of diminution of vision for near and distance, which is more in left eye than right eye for 5 months. And it is gradual in onset, painless and progressive in nature. She has been instilling eye drop betamethasone as over-the-counter drug for 10 years. And the patient's sibling and both parents had also undergone cataract surgery in both eyes at the age of 40 years and 50 years respectively. And there is also a history of eye drop betamethasone instillation in her family. On ocular examination, uncorrected visual acuity in the right eye is 6 by 18 and in the left eye is 6 by 60. And the best corrected visual acuity is in right eye plane 6 by 18 and in left eye 6 by 24 with the correction of -3 diopter spherical and -1.25 diopter cylindrical. And IOP, pupillary reaction and axial length are within normal limit. On slit lamp examination, anterior segment is within normal limit and here we can see the nuclear sclerosis grade 2, cortical cataract and discoid plaque-like opacity on the posterior part of the lens which is more in the left eye than right eye. On investigation, here we can see the opacity which is densely adhered to the posterior capsule which is more in the left eye than right eye. And here the management. Left eye phacoemulsification with PCIOL done under topical anesthesia and here trypan blue dye is injected and capsular access was done. Hydrodissection was not done to avoid the stress on the compromised posterior capsule and here hydrodelineation is done and all parameters was kept low. Here we can see the pseudo hole sign which implies the impression of the onion ring shaped opacity on the posterior capsule of the lens. And surgery went uneventful. And what is the unique in my case? As there is history of prolonged betamethasone eye drop use likely contributed to the development of cataract and clinical implication emphasizes cautious use of corticosteroids to prevent the drug-induced cataract. Steroid-induced PSC cataract would mimic a true or pseudo-PPC cataract in morphology and such a diagnostic dilemma can lead to errors in the surgical planning and management of the difficult cases. And it is challenging to remove surgically due to their location and potential for complications like PCR with vitreous loss. And take-home message, we should monitor long-term use of corticosteroids to prevent the complications and experienced surgeons should take a PPC cataract surgery with backup for vitreoretinal surgery. Thank you.
Dr. Monica Arora, please. Can I ask one question? Babita, apart from the precaution of not doing hydrodissection, what else you will take care of? And you have taken care while doing the surgery.
Hydrodissection should not be done, nuclear rotation also should not be done and the parameters should be on the lower side.
And one more important thing.
And
We should fill the chamber with viscoelastic
Yes,
while
sir.
removing the hand pieces. Irrigation should remain on and viscoelastic should be filled
Yes.
in the anterior chamber. Okay, next.
Thank you, sir.